Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
All right, what I want to talk about today is, as a chiropractor, you need good medical doctor referral relationships, especially in an injury practice. You need good medical doctor referral relationships. So what I mean by that is that you're going to be interfaced with the injury care of a patient. And when a patient has a ligament injury, one, you're going to need good referral relationships with radiology services. So when a patient has a ligament injury, there's only two things that you see on imaging. One is excessive motion, the other is disc herniation, or you can have both. I run a program called the Smart Injury Doctors Program, and our doctors know how to, one, accurately determine the severity and location of a ligament injury using stress radiology. That's looking for excessive motion. They know to use an unbiased third-party radiology service, and they know the benefit of that. You want to have good radiology services. If you need to have a disc herniation determined or not, then you also need a good radiologist for that service. Okay, there's two types of medical doctors. There's two medical doctors that you're going to need. One for excessive motion testing, one for disc testing, because those are two of the three. Those are the two major ligament conditions that you can have with spinal injuries. Now, the other thing that you want is you want to have great relationships with a local orthopedist group, with a local neurology group, with a local physiatrist. If you don't have any kind of physical therapy in your clinic, you want a good physiatry relationship. Some of these physiatry centers have excellent rehab equipment. If you need injections, you need good relationship with either an orthopedist or a pain management specialist or a interventional radiologist. If you want to get involved with PRP or stem cells as part of your care, again, you need to have great medical doctor referral relationships. Now, these relationships are not a one-way relationship. They're a two-way relationship if you're really confident with what you do. In the Smart Injury Doctors Program where I teach and train doctors to actually become stellar in the area of spinal ligament injuries. Stellar in the diagnosis of them, the understanding of them, the better patient management of them in order to get better results with them, and also the documentation simplification so that you simply understand everything that needs to be documented so that you become a real asset to anybody that you're working with, whether it's a medical doctor, an attorney, the insurance company, the patient, it doesn't matter. Everyone in the market is looking for those things. When you can deliver those things, you are also extremely valuable in the medical market. So you also need referral relationships, because if you're in the wellness business or you're in the patient business and the patient comes in with medical things that are outside of what you would normally treat, you want to have good referral relationships, and you want to find out who those referral relationships are. Who's the best dermatologist? Who's the best eye doctor? Who's the best audiologist? Who's the best ear doctor? Who's the best proctologist in your area? And develop relationships with them. If you're seeing 200, 300, 400, 500 new patients a year, some of you are seeing far more than that. You're going to run into situations that there's things that are going to be needed right away to send a patient out. And so you should develop good referral relationships, not only so that you can refer to these medical doctors, but also so that these medical doctors can refer to you. Now, when you go to a medical doctor, I get asked a lot, well, how do you develop medical doctor referrals? Well, first of all, one of the biggest tips I would have for you is find out where your local medical doctors congregate. If your local medical doctors congregate, say, at the golf course, at the golf club, there's a nice exclusive golf club or a nice tennis club in your local area, find out if that's a place that, one, really good medical doctors or really good attorneys actually have memberships. And if they have a membership, get a membership. Now, if you say, well, I can't afford that, it's part of the marketing budget. You're marketing. When you're spending time with people that can make a difference in your practice, that's what you want to be doing. So if I'm spending time outside of my business, one of the things I used to do is I used to think, and boy, I really had misidentified this. I used to think that, saving money on hotels was I'm just going to use this as a personal example in my own personal life. Saving money on hotels is fantastic. And I'm looking for the hotels.com, cheapest hotels, don't have to stay in the best hotels, picking up that crappy breakfast in the morning. And then I was with a mentor of mine who told me, look, you're never going to meet anybody of importance in a hotel like that. You're going to meet a person of importance in a hotel that's $400, $500, $600 a night. Those are the kind of people, when you're starting to go big in business, those are the people that are making things happen. And so even though you're spending more money, you will do a lot better. And I found that to be absolutely 100% true. So if I'm in a local area, I'm going to find out where the best medical doctors and the best attorneys hang out. Where do they go for recreation? Oftentimes it's a really nice golf club, or a really nice tennis club, or a really nice shooting club. Whatever it is that you have in your area. But I do a little bit of research on it, and then I would go to those places, because it's much easier to develop a relationship in the comfortable, relaxed environment like that than it is in other areas. But that's what I would be using them for. I would be using them not so much because I'm going to golf, or not because so much I'm going to play tennis, but because I want to eat at the club. I want to be around the club. I want to be with people that can make things happen. That's where my cardiologist is. That's where or when I say my cardiologist, that's where the best cardiologist is. That's where the best neurologist is. That's where whatever. That's where they go. Because if I can make that connection, they can connect me to other people. And the thing I want you to think about the most is when you have urgent care facilities, most of the time those urgent care facilities do not do much treatment for injuries. So those urgent care facilities need somebody to refer them to, and it might as well be you. And again, it's like any other thing that I've talked about. When you go to these professionals, there's three things that you want to have happen when you go to these professionals. One, you want them to like you, right? You want to be really likable. Two, you want them to perceive you as highly confident and highly competent at what you do, and be able to simply explain what you do. If I go to a medical doctor, look, we treat the most common cause of chronic pain and disability that goes undiagnosed. It's a spinal instability. It's a ligament condition. It's not picked up on MRI. It's an excessive motion problem. That's why it gets missed so much. That's why so many people have it. We're really good at diagnosing it. We're excellent at treating it. And we're excellent at documenting exactly what we did. As a matter of fact, I can easily send you over a report if you make a referral. I'm the clinic where if you have a family member that has any of these conditions, and ligament conditions can cause, you go to Medscape, they can cause so many different things. So many of the most common things that patients come in and complain about to you, head pain, headaches is like huge. Any kind of headaches, migraine headaches, cluster headaches, doesn't matter. Chronic neck pain, chronic low back pain, chronic problems with their arms, chronic, even if they've got things like visual disturbances that nobody can identify what's going on. They've got problems with balance that nobody can figure out what's going on. We're really good at locating a common source of all those things. And then we're good at treating them. So if you have a family member that had those things, we're the clinic that you would want to send them to. And that's why I'm talking to you today. I'm highly confident. I'm highly competent. I'm likable. And then when I walk away, what you want to walk away with, if possible, is, hey, do you have an email address? And can I get a cell phone number? I'll just stay in touch. We'll stay in touch. I'll send you over some stuff about my clinic. And I'd love to find some information out about your clinic, what you do. And maybe sometime we could schedule a time to have lunch at the club here or wherever. Doctors, I think you're getting the feel for what I'm saying. But one of the things that I want you to think about is take off the brakes that you have on spending money, especially spending money for things like clubs where these professionals that you want to do business congregate. That's a marketing expense. That's go to your accountant, go to somebody, get your clarifications. But essentially, whether you're paying for it out of your own pocket, you're paying for it out of your clinic, it doesn't matter. You got to go by whatever the rules are. But as far as I'm concerned, that's marketing. Remember, marketing is how you want to be perceived in the market. And you want to market to those that you want to be perceived by. So, doctors, as normal, on these podcasts, what I do is try to keep it short, sweet, and to the point on a particular subject. Put your comments down below. Put your struggles that you're having. Put anything that you were concerned about that I was talking about today. Put any comments that you want to down below. I do pay attention to those. And as always, I thank you for taking the time, giving me your attention today. And as always, I look forward to seeing you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.